Hello everyone. In this video I am going to discuss about the intermediate part of the Norma Basalis. The intermediate part extends from the posterior margin of the alveolar arch up to the anterior margin of the foramen magnum. In the intermediate part we can see in the midline structures like the vomer bone. So this is the vomer bone, and behind it we can find the body of the sphenoid. Here we can visualize the body of sphenoid, and this is the occipital bone, the basilar part of the occipital bone. In this, the important foramens which are lying, this is the vomerovaginal canal and this is the palatinovaginal canal. This palatinovaginal canal gives passage for pharyngeal vessels and the nerve. No important structure is passing through the vomerovaginal canal. Now we have the medial and the lateral pterygoid plates. So in this we can see on the medial side, this is the medial pterygoid plate and this is the lateral pterygoid plate. First we see the medial pterygoid plate. So here we can hold it like this. This is the medial pterygoid plate. This medial pterygoid plate has possessing its posterior border. So this is the posterior border. This posterior border, when traced upwards, we can see a fossa over here. This is the scaphoid fossa. This scaphoid fossa gives origin to tensor villi palatini muscle, and when it is traced downwards we can see over here the hamular like structure. This is known as pterygoid hamulus. This pterygoid hamulus provides a hook around which the tensor villi palatini muscle hooks and inserts into the palatine aponeurosis. And in the middle, there is again an elevation. This elevation in the middle, here we can clearly appreciate the elevation in the middle of the medial pterygoid plate. This elevation is known as processus tubericus, and this provides support for the cartilaginous part of the auditory tube. Then we come to the lateral pterygoid plate. So this is the lateral pterygoid plate on the lateral side. We can see over here, this is the lateral pterygoid plate. This lateral pterygoid plate has its medial surface, which is giving origin to the medial pterygoid muscle, and on its lateral surface over here, this is the lateral surface of the lateral pterygoid plate. This is giving origin to the lateral pterygoid muscle. So this is the lateral pterygoid plate, and this lateral pterygoid plate has its lateral surface, which is forming the medial boundary of infratemporal fossa. The infratemporal fossa is lying below the zygomatic arch, so here will be the territory of the infratemporal fossa, and it is forming the medial surface of the infratemporal fossa. Then we have different foramina on its inferior surface, like this is the foramen ovale, and this is the foramen spinosum. As we can see, this is the foramen ovale and this is the foramen spinosum, and behind it we can see the spine of sphenoid. So this is this elevation which is lying behind the spinosum, foramen spinosum. This is the spine of sphenoid. Now the structures which are passing through foramen ovale, these can be remembered by the mnemonic that is male, M-A-L-E, male. So M stands for the two roots of mandibular nerve, A for accessory meningeal artery, and L for lacetopetrosal nerve, and E for the emissary vein, which is communicating the cavernous sinus with the pterygoid venous plexus. Then we have foramen spinosum. This foramen spinosum provides passage for the three structures which are starting from M. So the mnemonic for this is the 3M. So 3M are, first M stands for the middle meningeal artery, next is for middle meningeal vein, and the nerve was spinosus. It is also known as meningeal nerve, so 3M. Then we have this spine of sphenoid, and this spine of sphenoid gives attachment to two muscles, that is tensor villi palatini and tensor tympani muscle, and three ligaments are also there for the attachment, that is sphenomandibular ligament, pterygospinous ligament, and anterior ligament of Malleus. So this spine, that is spine of sphenoid, it's related on the lateral side with the auriculotemporal nerve, and on the medial side there lies the chorda tympani nerve and the auditory tube. So these are the relations of this spine of sphenoid. Then we come to the lateral structure of this. On the laterally we can find at the Norma Basalis, that is the zygomatic arch. This is the zygomatic arch. Then it is made up of the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. This is the zygomatic arch. And then here we can see the mandibular fossa. This is the mandibular fossa. This mandibular fossa has two parts, that is articular part and the non-articular part. The articular part is this, where we can have the articulation with the condyle of the mandible, and the non-articular part is made up of the tympanic plate. This is the tympanic plate of the temporal bone. This is the non-articular part of the mandibular fossa. Then in between these two we can appreciate this fissure. This is known as squamotympanic fissure. This fissure lies between the articular and the non-articular part of the mandibular fossa. Then here we can see the downward extension of the tegmen tympani, which is a part of petrous part of the temporal bone. This divides the squamotympanic fissure into two parts, that is anteriorly we have petrotympanic fissure and petrosquamous fissure, and posteriorly we have petrotympanic fissure. These can be clearly appreciated in the separate temporal bone. So here we can only see the petrotympanic fissure. This petrotympanic fissure provides passage for the chorda tympani nerve, anterior tympanic branch of maxillary artery, and the anterior ligament of Malleus. So here we can see, or we can appreciate the petrotympanic fissure. Then we can see the foramen lacerum over here. This is the foramen lacerum. Here we can see the foramen lacerum. The boundaries of foramen lacerum are, anteriorly it is bounded by the body of sphenoid, and posteriorly we can see this petrous part of the temporal bone. This is the petrous part of the temporal bone, and this is the posterior boundary, and medially it is bounded by the basilar part of the occipital bone. So this in its posterior wall, which is occupied by this posterior wall of the foramen lacerum is occupied by the anterior opening of the carotid canal. So this carotid canal, which is giving passage for internal carotid artery and the sympathetic nerve fibers around the internal carotid artery, these structures passes through the posterior wall of the foramen lacerum, which can be seen through this interior of the skull over here. This is the posterior wall of the foramen lacerum, which is related with the carotid artery. So this carotid artery comes to lie on the posterior wall of the foramen lacerum over here. So here you can clearly appreciate the foramen lacerum, whose posterior wall is related with the internal carotid artery. The upper opening of this foramen lacerum over here, this is giving passage for internal carotid artery. This internal carotid artery passes from here to the carotid fossa. This is the carotid groove on the lateral aspect of this hypophyseal fossa. So after taking entry in the skull through the carotid canal, this artery comes to lie in the posterior wall of the foramen lacerum. Then it passes forwards in the carotid groove this is the carotid groove over here, this one, which is lying lateral to the hypophyseal fossa. There is a plate of cartilage which is lying in the inferior wall of this foramen lacerum in the recent state. So this foramen lacerum is closed in the recent state by this cartilaginous plate. So no important structure is passing through this lower opening of the foramen lacerum, except only the meningeal branches of ascending pharyngeal artery are giving passage, or they are passing through this foramen lacerum. Then we have the carotid canal over here, which is giving passage for internal carotid artery and the sympathetic nerve fibers around it. Then we can see the styloid process over here. This is the styloid process, and this is the jugular foramen. This is the jugular foramen, we can see. This jugular foramen giving passage to the 9th, 10th and 11th cranial nerves, and most posteriorly we can see this is the mastoid notch, which is giving attachment to posterior belly of digastric, and this is the mastoid groove, which is giving passage for occipital arteries, and this is the lateral aspect of the mastoid process. So in the next video I will be coming up with the posterior part of the Norma Basalis. Thanks for watching.